I'm Vicki Rowse. My current role is as clinical lead for community paediatrics at the Hampshire Hospitals NHS Foundation Trust. I went to Cambodia in 2010 for 4 months as part of the Improving Global Health programme, which is run by South Central Health Authority. When the Improving Global Health programme was advertised, they were particularly looking for paediatric practitioners, and it seemed an ideal opportunity. Partly because it was an overseas placement, but largely because it was a placement that was focused on leadership development and service improvement with the view of bringing skills back to the NHS. The project centre was based in Battambang, which is the second largest city in Cambodia, but the actual Millennium Development Village area was 70 kilometres out into the rural area, close to the Cambodian-Thai border. And an area that the Khmer Rouge had retreated to, and that's one of the reasons it had been not had an awful lot of development in the previous years. I ended up working on a family planning project and also on a project to try and validate maternal mortality because the figures that were being reported were very small. One of the biggest problems was nobody spoke any English at all, even in Battambang as the second largest city. And the Cambodian members of staff we were working with, English was poor. Out in the rural area there was no English at all, so you really had to think about your communication skills. And I had a fabulous experience interviewing one of the traditional birth attendants, where we were sitting on a platform outside her house with 3 open sides, looking out across paddy fields and palm trees, the rain coming down, and a 3-way conversation between myself, an interpreter, and this lady. There were downsides. I mean, being in the rural area, it did sort of detach you from our comfort zones of IT things because we only had a generator for a few hours in the evening. I think some people find it quite isolating not being able to have their own space. So we were sharing rooms, eating communally. The weather was the downside because it was incredibly hot sometimes, and you were having to be in places where there was no relief from the heat, really. I think for the NHS, I've learned an awful lot of service improvement skills. I think I've come back with the confidence to use those in other ways. And I think the fact that I've gone on to try and do the next stage in my leadership development and have actually got a Florence Nightingale Foundation scholarship is evidence that I have changed, and I'm very keen to go on. I would absolutely definitely do something similar again because it's such a good learning experience, and you do come away feeling that you've benefited and other parts of the world as well. If you can do it, absolutely do it because you just get so much from it, not only professionally but personally as well.